This is my informative speech. What is malpractice? It is the accidental or intentional act that causes the harm of someone else, which goes against the Hippocratic oath established in ancient Greece by Hippocrates. And malpractice has been prevalent really ever since the Garden of Eden, because man is generally self-centered and wants to be God, and is willing to accept being a puppet for Satan unintentionally in order to feel that false power. And unfortunately, our medical professionals also fall prey to that kind of temptation. In 1 Kings chapter 2, it says, I go the way of all the earth, be thou strong therefore, and show thyself a man. And keep the charge of the Lord thy God, to walk in his ways, to keep his statutes and his commandments and his judgments and his testimonies, as it is written in the law of Moses, that thou mayest prosper in all that thou doest, and whithersoever thou turnest thyself. And of course, if people are not believers, they will be a lot less likely to walk in the path of righteousness. Malpractice through the ages has consisted of good intentions gone awry from time to time, such as drilling a hole in one's skull to extract demons, or to relieve pressure on the brain, although that one is still used today sparingly for that purpose, if nothing else works. It has involved throwing the feeble-minded in institutions, and oh gosh, what else? Yeah, prescribing opiates, heroin, and then also cocaine. As a matter of course, that used to happen all the time. Coca-Cola, for example, that was derived from that specific time period. Opiates were used actually all of the time, particularly in high society. And also, before anesthesia was created, operations including root canals or whatever happened without it. And my father actually described a dental procedure he underwent without anesthesia. Not pleasant. So luckily, medical science has come a long way to an extent, but there's still some ghastly practices that still go on, and I'm here to cover some of them. Unfortunately, what is more prevalent than the Hippocratic oath a lot of times in hospitals is to not rat on your bosses and coworkers. It makes the whole hospital look bad, and they want to avoid lawsuits that are very costly, and they think it's in the best interest of the patient to not tell them sometimes when mistakes are made. And especially when people are in residencies, they can go for hours and hours without sleep, and things happen when you don't have sleep. And other times, there are some doctors that just play God, and sometimes the nurses even know more of what's going on in the hospital with the patients than the doctors do. I've heard quite a few stories personally, but I guess one such doctor that thought he could maybe earn a little bit more money for his hospital and for himself. I can only imagine what his motivation was Dr. Farid Fatah. He was arrested in early August for dispensing chemotherapy to patients who didn't need it. This practitioner was sued 3 times previously. So that shows there definitely is a cover-up in the medical establishment, and that really needs to be reviewed and looked at, probably individually first. Malpractice state to state. The total cases of malpractice in 2010, looks like the front runner for that is New York with 3,861. And cases per 100,000 population is 19.9. And so then there are population ranks, and this is according to the United States Department of Justice, I believe. So it looks like the highest ranking for population would be Rhode Island with 44, and the lowest would actually be New York with a population rank of 3. So I guess that's a per. Yeah, I'm not quite sure exactly how they came to those conclusions, but I'm including the link for that website. Some of the most prevalent cases that I came across, Kim Tutt was a cancer patient who underwent many disfiguring surgeries to remove cancer that she never had, as it turned out. Paul Lozano was sexually abused by his mother as a child. His therapist decided that the best way to overcome that tragedy was to, what she called, reparent him, which included also sexually abusing him. And so he committed suicide. Graham Reeves was in his 70s, or I guess early 70s, when he had the wrong kidney removed twice by 2 different surgeons, and he died. I believe that was in Wales. And stories all over the world are surfacing regarding surgical instruments left inside patients, and we also hear of botched plastic surgeries and things of that nature, which are supposed to have a much lower risk factor than, say, removing the thyroid, which I'm not going to have done, even though it has been recommended that perhaps I do have it done. Here's one thing, though, that you may not know, that there are increased risks of being set on fire during surgery. Now, I don't know about you, but that's slightly unsettling. And also we've heard of, people being under hypnosis or being under anesthesia and being sexually assaulted and things like that. So that's another fun thing. So what are the solutions when it's so overwhelming? I guess we can look into malpractice laws from state to state, so we can do that. But the biggest thing is just being a smart consumer, like with everything else. If you're buying a lawnmower, look into, how well the lawnmower functions. It's the same thing with a doctor. Find a competent doctor through word of mouth, credentials, obvious credentials. Make sure it's on their wall and not from some crackerjack college, but from, a well-recognized university and all that sort of thing. Google them. That actually can bring up a lot of stuff that you might not find out normally, and maybe even court records, because a lot of that's open to the public. Ask many questions to the physician about risks involved, recovery times, treatment options. If the physician actually is caring, they will welcome these inquiries and even answer questions you didn't even know you had. That's been my experience. If any big decisions come up, such as chemotherapy, major surgery, I actually Googled about my knee and found out I did in fact need ACL surgery, so I had that July 1st of 2008, and I'm actually doing very well now. They used part of my hamstring, and that's actually the best possible version of that surgery. But anyway, if you're feeling ill at ease about the doctor's recommendation, don't hesitate to get a second opinion. that's just the way that has to go. It's not the doctor that has to live with the decision forever. It's you. So just get a second opinion and maybe a third opinion. And sometimes the natural way is the best way to go, like with my Graves' disease. And not all doctors are trained that way. So just be vigilant. So the biggest thing is the Gosnell case. I'm sure a lot of you have heard of him. He brought a lot of attention to the entire malpractice issue, and he also brought to bear some scrutinization to medical practitioners and other abortion doctors. I don't consider them doctors because anyone that ends up dead on purpose is not really, that goes blatantly against the Hippocratic Oath. But luckily, the Gosnell case is bringing attention to that issue, so it's important. So the references for Matthew Clark for the Gosnell case, pro-choice radicals, you go to there. I'll be putting that into a separate document over the links to go to for that. But it's Gosnell Infanticide Mere Malpractice, American Center for Law and Justice. Simon Griffin brought up some of the cases that I used for 10 horrible cases of medical malpractice. Retrieved from listverse.com. And Dave Phillips from the Oakland Press, accused doctor had history of malpractice complaints for FATA. And then the state-to-state one is United States Department of Justice, and courtstatistics.org is the link I'll be giving you for that. So with everything, there is an upside and a downside, and God or Satan can use anything for their own benefit. So always look to God, always pray about any big decisions that you make, and if you can find a Christian physician, that's actually the best way to go. So take care.